stuff. But let me return to the studio and continue with our discussions, especially as we inch closer to 9 o'clock. Today we are speaking menstrual hygiene and health in rural areas. Half of the world's population will spend half of their lives menstruating, that is, having periods. Yet over 500 million women and girls around the globe lack access to hygiene materials as well as safe and clean facilities. The period poverty is detrimental to their physical, mental as well as emotional health. Some have come out to seek help to the challenges, including many organizations that are now leading initiatives across the country. This morning we are joined by Elvin Turibamwe. He's a Rotaractor with the Rotary Club of Najjeera. He's leading an initiative, or part of a team that is leading an initiative in one of the rural areas in the country, and he's going to be sharing with us. A very good morning, Elvin.
A very good morning.
Welcome to Morning at NTV.
Thank you so much for having me.
First things first, what is the thrust of this intervention? I know menstrual hygiene is a huge challenge, especially for young girls and also women across the country. And I'm glad that there are targeted interventions for rural areas. If you don't mind, let's begin on that note.
I like the fact that in your introductory remarks, you've given perspective to this challenge, especially on a very large scale, the global scale. But I want to mention that when you bring it down to Uganda, it's even worse. You know, it's even more scary. So what informs our desire to come in and intervene is the realities that face our communities down there. So
that's right.
As a Rotaract Club of Najjeera, we've gone down to these communities and had interactions with some of these people. And it's very worrying what's on ground when you speak to young girls, or when you get to understand that actually there is very many girls out there who miss 3 to 5 days of their school days in a month. And when you bring it down, it could amount to almost a quarter of the year lost to these menstrual cycles. So the challenge is huge, and as Rotarians or as Rotaractors, we took it upon ourselves to play a part, however minor it might be, but at the end of the day, it's about making a contribution to try and scale down the figures or the statistics.
Okay.
Yeah.
Now, when it comes to the decision on which particular part of the country in which to intervene, I think it does present a headache sometimes, because
exactly.
we do know and have reports that keep coming in from Western Uganda, Eastern Uganda, the North. I do not know whether there is a particular scorecard that you use to say this is the most affected area, so the intervention goes here. Or as the Rotary Club, there is already a set way of doing things.
Honestly, there is no clear guideline of what area do we go to, especially considering the fact that healthcare challenges and maybe menstrual hygiene challenges are not unique to Mitooma district. I mean, when you go to Eastern Uganda or Northern Uganda, these challenges are identical. So as a club, this project was inspired by a very personal story of one of our members who, upon having an interaction with one of the local leaders of that district, this conversation came up. And this club member reached out to me and expressed their discomfort with the statistics and the reality on ground, and we had a chat about it. So as a club, we took it upon ourselves to make this one of the projects we'll carry out during this year of our service. So I wouldn't say there's any criteria we followed to choose Mitooma district, but I would say it's our entry point to address the bigger challenge, and maybe other organizations and other Rotaract clubs can pick inspirations and also go into other communities.
Okay.
Yeah.
And particularly because an individual from the region or from the place itself was able to reach out to you, and this of course creates platform that can be exploited by organizations and other players, as you say. We do hope that the clarion call is heard out there. Now, when it comes to individual challenges, people often imagine the girl child in school is heavily affected. But menstruation goes on for women even after school. And many who become mothers continue to grapple with those particular challenges. Now, on top of everything else that comes with motherhood, they also continue to grapple with that. And for many women, it is a choice. I either do this or not. Is it an intervention that can be, for example, designed to ensure that all categories, school children, the girls, the young adults, the women, are all catered for? Is that a conversation that comes through when you are strategizing?
Yeah, sure. When we are designing these projects, sustainability is one of the key areas that we want to pay attention to, because this outreach is beyond, going to Mitooma district and distributing sanitary pads to young girls. It goes beyond that. It goes beyond that. It goes all the way up to creating awareness through the teachers, through the parents, and the community at large. And look, we are not just taking sanitary pads to the kids, but we are also teaching them how to make reusable sanitary pads, because the question of affordability is very important. You could give out supplies of these towels, but then sustainability in terms of affording these sanitary pads long after you've left the community is very important. So we are coming with an empowerment aspect where we will teach these young girls how to make reusable sanitary pads, so that even when we are long gone after this project, they can continue to make reusable ones and actually use them. But also creating awareness, especially to teachers and parents. It will go a long way in reducing what the experts call menstrual stigma, because the suffering is not only for those 3 days that the girls miss, but also the stigma that comes with it. Other children mocking them at school, and also parents not knowing how to exactly address this, and teachers. So think of it as a bigger campaign to create awareness, to skill, and to also empower a community to address this challenge for the future.
Now, when it comes to period shame or stigma around menstrual challenges that the girls go through, men are critical allies. But often the conversation among men is also tricky, because it's soaked in judgment, especially to the girls and the women. So much so that those who are seen to be affected are either shunned by the community. This community has men leading that particular stigma. I do not know how far involved the men are, especially those that live and relate with these girls on a daily, the fathers, the brothers and the peers in school. I know the awareness campaign is broad, but I'm interested in the specifics of how you're bringing them on board as allies.
It's very interesting, and I think it's also a positive to find that it's a man on this show talking about menstrual hygiene. I think that's a step in the right direction.
Very.
But also at club level, as a Rotaract Club, we want to involve our gentlemen as much as we can, especially in skilling how to make the reusable sanitary pads. So when you get them hands-on, then you're getting them there. And when we get on ground, we do not want to exclusively deal with the girl child or the female teachers. We want this to be a conversation for everyone. We want this to be a conversation for all the men out there, and it starts with ourselves. If, for example, as a club we took a project and it was being fronted by only females, we would not be taking the right footstep in that direction. But considering that we have gentlemen from our club that are leading on this, and considering that also we want to work with male teachers, we want to work with male parents, I think we are trying as much as we can as a club to make this campaign as inclusive as it can be, because like you said, in most cases it's the men that lead on this stigma, but when we get them to the forefront of fighting this, then we are halfway the solution.
All right, thank you very much. Any last words, by the way, before I close the conversation?
Yeah, my last words would be to call upon everyone, organizations, companies and individuals that can join us on this project. You can come in any way you can. It can be financial, it can be in-kind support, it can be actually coming with us down to Mitooma district, and we create impact on ground. So I want to rally the public, I want to rally our viewers, first of all, to join a Rotary or Rotaract Club, because there's a lot that we do in there. And when you're choosing one, I would prefer that you choose the Rotaract Club of Najjeera. But also for this particular campaign, we call upon all of you, companies, brands and organizations and individuals, to join us on this cause, and let's put a smile on people's faces, and let's create sustainable impact.
Maybe very lastly, in light of the clarion call that you've just made, the date for this intervention, but also the specific venue.
So this campaign will be carried out from the 10th up to the 12th of October, that's next month, and that will be at Katenga Sub-County in Mitooma District, and particularly at Mitooma Primary School in Mitooma District.
All right, there you have it. Many thanks, Elvin Turibamwe, Rotaract at the Rotary Club of Najjeera. Many thanks for sharing and, of course, leading the campaign to ensure that girls and young women out there go through positively the challenges that they face, especially when it comes to stigma and period shame.